So that was the key issues for all Cochrane reviews, but we also wanted to give you some information about equity-focused reviews. So what might you consider for those? So you'd want to think about whether there are populations that experience health inequities from the condition that you're interested in, or whether there are populations that might experience disadvantage related to the intervention you're assessing, and whether there might be social gradients in the burden of disease. So are there differences in absolute or relative effects? So we've defined an equity-focused systematic review as one that assesses the effects of the intervention targeted at a disadvantaged group. So this might not include equity outcomes or specific equity outcomes, but because the intervention is targeted at disadvantaged populations, then the goal would be there that the inequities are reduced. Or the systematic review could be aimed to assess the effects of interventions aimed at reducing social gradients across the population or among subgroups of the population. So this might be an intervention that's aimed at a total population, like obesity prevention in children, but that explores subgroups that might look at differences based on different population characteristics. So I'm not going to go in a lot of detail for all these 10 steps, but I'll give you some examples for a few of them. So we think there are 10 steps in the systematic review process where you could think about health equity. The first would be when you're defining the conceptual approach to health equity. The second would be in thinking about community effectiveness and how the implementation of the intervention might be different than the efficacy studies have shown the intervention to work. The third would be in developing a theory-based approach. So by this we mean a logic model or an analytic framework or some way that you've thought about the mechanism of action and how the intervention might impact the outcomes that you're interested in. Then framing the health equity question, thinking about what relevant study designs you might include. So to get information about health equity, you might need to consider additional study designs that you might not typically consider in your Cochrane review. The sixth step would be when you're identifying information sources for health equity. So again, some of the literature that you might be interested in could be in databases that you wouldn't, or that would be outside of the typical databases that we search in Cochrane reviews. So some of the information might be in social science databases that you would not have searched for sort of a typical Cochrane review question. The next would be in defining your search terms for health equity questions. So there is a new equity filter, and we don't have a link in this review, but we could send that around. And there's other tips around about how to think about search terms for health equity. But it could be challenging, and you probably want a librarian to help you think through those issues. The eighth step is in developing data extraction tools for health equity. And so, as we've said earlier, we think that you want to think about health equity when you're planning your data extraction, so you can capture the information that might be needed to address some of these equity issues. The ninth is a modified summary of findings table, and I'll show you an example of what we mean. And then the 10th would be when you're assessing the indirectness of the intervention or the evidence. So just an example, for the first one, defining the conceptual approach to health equity, the same review on food supplementation for preschool children defined what they meant by socioeconomic disadvantage. So for low and middle income countries, that meant that the participants had to be from rural areas, villages, provinces, or deprived areas, or the parents had to have low average education, or they had to be manual workers or unemployed, or the families were low socioeconomic status, or the children were described by in the studies as being low income, malnourished, underweight, or stunted. So that's how they operationalized this socioeconomically disadvantaged children for their review. The second point was about community effectiveness. So there's a lot of points along the pathway from the efficacy of the intervention to how it actually gets implemented where you might lose some effectiveness. So there could be barriers to accessing the intervention. There could be conscious or unconscious bias from the providers about recommending the intervention. Consumers may not be able to adhere to the intervention because it's not feasible or it costs too much, or there could be lots of reasons. why the effectiveness could be much lower than you might think. And so we recommend that authors think about where these sort of issues could occur so that you could extract and include that information in your review. The third item was developing a theory-based approach, and so this is just an example of a logic model. So there's some equity considerations under the contributing factors and the populations, and then there's some equity-related outcomes that they're interested in. So this just shows how those all relate to each other. So skipping a few, identifying information sources for health equity questions. There's a few places that you could get help about where to look for equity literature, but for example, the Cochrane EPOC group keeps a list of databases on LMIC, from LMIC, so they have a list of databases, websites, and journals that might have additional literature to that that's indexed in the regular databases we search. And then skipping again, data extraction tools. So this is an example from the preschool feeding review again, but they wrote that they extracted data that included details about the participants' age and socioeconomic status, as well as sort of process factors that might cover some of the things related to how the intervention was implemented in each of their studies, so that they might be able to include some information related to health equity. And then modified summary of findings table. So we've talked about that a couple times with relation to baseline, how you could present differences in baseline risk and subgroups. So you could do a separate summary of findings table to explore subgroups, but you could also include additional lines or rows in your SOF to present different baseline risks. So for this example, they presented the baseline risks. They presented the effectiveness by baseline risk, and so the group that had the highest baseline risk also had the greatest effect of the intervention. So we have on our website a few resources that could be helpful for all the steps of the systematic reviews on equity. So there's a reporting guideline, Prisma Equity, that helps think through what additional things you could report to make your equity reviews more transparent. The Grade Equity series is also available there. We have an equity checklist that would help you plan your review. There's also a section gender planning tool, which helps you plan a review with specific issues related to sex and gender. And there's actually a sex and gender subgroup of the Cochrane Equity Methods group that looks at lots of ways that sex and gender could be considered in systematic reviews. And then, as Vivian mentioned, we're working on Cochrane training modules that we hope to release in the fall. So if there's anything that we could provide that would be helpful for you to help you include equity in your review, you can get in touch or ask questions after this session. And that's just a link to our website. And that's just some other resources in addition to equity-specific resources. We have some other resources for planning and conducting your review. So the key messages that we wanted you to take away were that you should think about equity early in the review process and plan how you'll address those 4 key equity considerations. So how you'll think about baseline risk and potential differences, differential effectiveness of the intervention, the outcomes of interest and how they might be different for different populations, and the implications for equity. And I think we have a poll, so would you consider equity in your next review? So most people said yes, and some people said maybe, and nobody said no, so that's good news for us. Okay, and that's references, so I think we're open for questions now. If anybody has any?
Okay, so we have one question, we have a couple of questions. Let me just put one in the questions box. So Gil asks, I wonder if you could talk about how equity considerations interact with grade in terms of indirectness.
Yes, we can.
Okay,
and
sure.
I'll pass that to Vivian.
Right. Yeah, so thanks for the question about grade and indirectness. So Cochrane reviews, where now, summary findings are mandatory, which includes rating the quality of the evidence with the grade quality tool. let's see, the general approach to that in the Cochrane review is to assess the directness of the evidence across PICO, so the population, the intervention, the comparison, the outcome. And because most Cochrane reviews are taking a global view, as far as the studies are including the population of interest, let's say insulin for diabetes, then they're not likely to rate down for indirectness. Where we see indirectness being more an issue about equity is for review questions that are focused on disadvantaged or historically excluded population. For example, migrants is one issue that some of us have worked on, where evidence may not come from migrants but other populations, and people might think that there is good reason to rate down for indirectness. So I think that consideration about indirectness is focused on those populations. I think for Cochrane reviews, it's difficult to ask all Cochrane reviews to think of all possible populations that might be vulnerable or disadvantaged in the context of that that question or problem. But there are some reviews that do, for example, the school feeding review that Jennifer showed. And in those cases, indirectness is one way to indicate, concern about whether the evidence would apply in a different population or a different setting. I hope that answers the question. And then that's described in our in the JCE series on the grade equity group that Jennifer showed in the early part of these slides. So there's a bit more detail there.
Okay, and Eleonora asked, can we find the equity search filter on the website?
Yes, I will put it there. It's not there now, but I'll put that paper in.
Yeah, it's also, I believe, referenced in the Cochrane Handbook chapter on equity, the new chapter.
Yeah.
Yeah.
Okay, and then another question from Eleonora. IPD meta-analysis seems like a way to reanalyze published data from an equity perspective. Do you have any experience or advice on this? So IPD in individual patient data.
Yes, that's a great question. So there's actually a great example of a Cochrane review on injuries. I think that Alex Sutton and Diane Kendrick were the lead authors, where they looked at IPD to assess whether preventing household injuries for children, whether effects were different across socioeconomic status and other issues. So yes, I think you're right that that's a possible way to address, effect modification across characteristics of interest and priority populations. It is time intensive and resource intensive, and in many cases I would say that the data retrieval is imperfect now, but I'm currently finishing an IPD analysis where we had some limitations in the data we retrieved. So I think you're right, it's important for equity. I think we have a bit of ways to go to promote open data and availability of data to, enable those kinds of analyses to be more robust. Yeah, couldn't agree more. So I don't think we mentioned that in the Cochrane Handbook chapter, but it's something to explore for sure.
Thank you. Janice, she asked if you will share the slides from this presentation, and I think yes. That the answer is yes. We will share the recording and the slides also. And Janice also says that she appreciates quite a lot this overview of equity. She said she's a PPI who has taken GRADE workshop and will be attending GRADE conference next week in Denver. So Janice Tuft, looking forward to working with you. We have another question from Ayat. and it's about, has any method for synthesis the Gini index or concentration index been developed?
Yeah. Okay. That's a good question. Thank you. So the Gini index and the concentration index are tools used to look at distribution of income inequality. When we started the equity methods group, one of our ideas was to think about how you measure inequities and how you could use things like that in a systematic review. In practice, that kind of information is rarely available in the kinds of studies that are included in reviews. So we've not focused on that in the handbook chapter. I do know of one trial that did look at inequalities in, I think it was child health, in the context of an effectiveness, a pragmatic trial. But it's, I think it's a while before we see that coming into Cochrane reviews as an outcome measure. That's a good area to look at for the future, I think.
Okay, so thank you. I don't think we have any further questions. So let me then just is there another question just coming in? Okay, there's another one question. So Montserrat asks about if resilience factors, both at an individual level as community level, are thought to be included.
Yeah, that's a great question, Montserrat. Thank you. So I think in our concept of social capital, we are thinking about social networks that might promote health. Resilience, we've not worked on it as a focus topic within the equity group. I agree with you, it's very important. And it's one of the reasons that we've actually tried not to use the word vulnerable populations, because vulnerable populations, has the risk as well as the resilience. And in some populations, there may be more resilience that would sort of offset, exposure to harmful and noxious settings and situations. So I think you're right that it's an important factor to collect in some reviews and to explore. And that's really our kind of fourth point in the key considerations, is thinking about the context and the setting. So that's a great point that we could add to the training modules about that point.